All right, welcome back to the Sports Wrap. Throughout the football season, we bring in Dr. Paul Fadale of University Orthopedics. He is our injury expert. And unfortunately, on this Sunday, we have plenty to talk about. Dion Lewis, the little 5'8" shifty running back, he tore his ACL back in November. He had surgery, was on the field as recently as this spring, and then reports today that he needs what could be a cleanup surgery and out for a little while. With your expertise, what does this all mean?
So I think the news is good. It's probably not re-injury to the ACL graft itself, but what we'll never know is what other injuries were in there. So either he may have had further meniscal damage, could have been sewed in, never healed, they have to trim it out, could be a little arthritic patch that's catching, they got to clean out, or a little bit of scar that is building up inside of his knee and he just can't get over it. So this is well within the time that you could bring him back to the operating room, clean him up, and still expect to have a pretty good outcome.
Everyone wants to know how long of a recovery before he's back on the field, do you think?
Well, if it's just a simple cleanup, that should be within 4 weeks or so. The question is now he's coming off an ACL reconstruction, and how far along was his recovery? As you and I both know, good Lord, these could go 6-8 months to a year or longer before these athletes are ready.
All right, offensive lineman Shaq Mason, he's out with a broken hand, a guy who's in the trenches using his hand. For what he does, how serious is this injury, and how do you think
offensive lineman?
Yes,
that's great. So difference, offense, defense. Defense has to grab, pull, and push. Offense theoretically just has to block. So for our offensive linemen, when they have hand fractures or wrist fractures, as long as that fracture is stable, we can pad it enough to get him back in the game. So he's in a pretty good position, if you will, that once that fracture gets stabilized, he should be back, quote, relatively quickly.
All right, Sebastian Vollmer, another offensive lineman. He's had a shoulder injury, but this specifically is the hip. As a guy who plays at the end of the line, you know, he's doing a lot of turning. How serious is this? Because he's on IR, he could be out potentially for the year.
It actually is a bit of a problem. So most of these hip injuries are, if you will, almost congenital. You're just born with your structure a little bit off, and over time, with wear and tear, you start breaking down. You start getting a little bit of arthritis. You start getting some labral damage in there. And these kids usually can play through it, but over the years it gets harder and harder and harder until something starts to really grind down, and then they just can't do it anymore. So we don't know where this is going. One possibility is he may require an arthroscopic cleanout of that hip or repair.
And he's getting older, so that could be a game changer for him. All right, going back to some injuries that have been in the news for quite some time now. Malcolm Mitchell in that preseason game, a gruesome injury, what appeared to be his arm and elbow, and it bent a way that it shouldn't have. But he's been back on the practice field. One of those things where it looked worse than it is. You're not, working on him right now, but in your expertise, have you seen things that look much worse than they actually are?
Yes, elbow dislocations look horrific, and they'll come out and the arm will be just off, and you'll say, oh my God, there's no way this is going to work. You put it back in, you bring that athlete through rehab, and it is incredible how fast they will come back with minimal deficit. So that counterintuitive to what you would believe.
Right.
Actually, this is not surprising that he's coming back.
All right, Rob Ninkovich, tough guy, torn tricep though. The thought of a torn tricep makes me cringe. Again, he's been out there not really engaged fully with the team, but what kind of recovery for a guy of his ilk, tricep?
So look at the position he plays. He's pushing 300-plus pound gentlemen back on their heels. No triceps, you really can't play that at all. And so they come in different sizes and grades, if you will, and so we don't know exactly how bad that triceps injury is, but until he's got the strength to push at that level, he's really not going to be very effective on the field. So he's going to have to go through an enormous amount of rehab to get him back.
All right, I know you're an orthopedic surgeon. Tom Brady, I think, hurt his thumb with some scissors. You're his doctor. What do you do to get that thumb back to normal?
Well, we have a little wiggle room here, which is unfortunate that we have wiggle room, but so the pressure's off you as his treating physician, but you just have to keep it clean, not infected. These guys are pretty tough, even if it's his throwing hand. I don't think this would really affect him at all. I'm sure as long as he didn't get down through where the nerve endings were, which would be a bit of a tough cut if he did.
All right, Julian Edelman has been dealing with a foot injury dating back to last year. He had an off-season surgery, but he's been, seemingly up to full speed in practice, hasn't been at a game anything you've seen of him, how do you think his recovery's been?
Boy, I can tell you, these Jones fractures in your feet, they can go in a multitude of ways. So you think, gee, it's a small little fracture in the foot. What's the problem here? And the problem is there's no blood supply to this area. And they are notorious for not healing no matter what you do to them. So you can put a screw in there, bone graft it, protect them, and still it doesn't get 100% healed. So they're going to put some things in his shoes to really stiffen up that area. Plant, twist, turn, at any shot. He can feel that thing go, and I think that's what he's worried about.
All right, switching gears now, I want to get one question in. Our Little League coverage has been ongoing, and obviously everyone knows there are certain rules. If a kid pitches X amount of pitches, he has to wait X amount of days between pitching more. In your experience, how have you seen that evolve over the years? Because I think as a society we've gotten more wary of that, but you see a lot of kids still getting Tommy John surgery and such at a young age.
I think this is great. So just like we'll go back to concussions. We sort of blew it off and no one took it seriously until we realized the long-term repercussions of this. It's the same thing with these young athletes. We really have to protect them from the overuse. You have one or two good throwers out there, and we're going to have them throw nonstop right to the finals. You can't do that because there'll be long-term changes in their shoulder that are going to be very destructive. So this is fabulous. The only trick is we don't know the science of how many pitches, how long, how much. We're trying to figure that out now.
Because I remember when the Red Sox used to bring Japanese pitchers over, they threw much more and oftentimes seemed healthier, so it's kind of different viewpoint culturally there. But all right, Dr. Paul Fadale, thanks so much for coming in. Hopefully we won't be seeing you to the start of the season, at which point everyone's healthy, but thanks for coming in, and we'll have much more from the Sports Wrap coming up right after this.